Keratosis pilaris is a common skin condition also referred to as strawberry skin or chicken skin. The big question is, what is the cause of keratosis pilaris? How do you manage it? And what products are best suited to reduce the appearance of chicken skin? In this video, we are sharing everything you need to know about keratosis pilaris. If you're joining us for the first time, we post skin education on this channel, so make sure you subscribe and hit our notification bell to avoid missing any future videos. Keratosis pilaris originates from the Latin terms keratosis, which means scaly skin or an area of the skin marked by the overgrowth of horny tissues, and pilaris, which means hair. Therefore, keratosis pilaris is a very common dry skin condition caused by a buildup of keratin in the opening of the hair follicles within the skin. In this condition, small bumps develop on your skin, especially your upper arms, thighs, cheeks, or buttocks. Keratosis pilaris is also known as chicken skin because the visible bumps appearing on the skin resemble that of goosebumps. The dry, sandpaper-like bumps are usually white with some inflammation, and the skin color can appear darker depending on your skin tone. It often starts in childhood but becomes more obvious during the teenage years and can disappear in adulthood for some people around the age of 30. It is harmless and is not infectious. If you have keratosis pilaris, KP, you may notice small, painless bumps on your skin that just don't seem to go away. These tiny bumps or pimples are dead skin cells plugging hair follicles on the skin. The bumps consist of excess keratin, a protein that helps form your hair, nails, and skin's outer layer. As a result, keratosis pilaris bumps may look red, white, or take the same color as your skin. This condition usually worsens during pregnancy and in winter when the skin tends to dry out. What are the causes of keratosis pilaris? Keratosis pilaris occurs due to abnormal keratinization of the upper portion lining of the hair follicle. The keratin fills the follicle instead of exfoliating, making the keratin of your body hair get stuck in the pores, blocking the opening of the hair follicles. A small bump therefore forms over where a hair should be. Picking at the bumps will only make them more visible and increase scarring and discoloration. The exact cause of keratin buildup is not known at the moment. However, there could be genetic factors, meaning your genes could affect your chances of developing this condition. It can also be associated with dry skin, vitamin A, and essential fatty acid deficiency. A deficiency can result when digestion is compromised and thus reducing your GI tract's ability to absorb fat-soluble vitamins. Keratosis pilaris is common in women, children, or teenagers, as well as those with eczema and psoriasis. There is talk that keratosis pilaris is linked to gluten sensitivity, because if you have celiac disease or gluten sensitivity, you are at risk of poor absorption. This could increase your odds of having keratosis pilaris due to the nutrient deficiencies. What are the symptoms of keratosis pilaris? Bumps can appear anywhere on the skin where hair follicles exist, but will never appear on the soles of your feet or the palms of your hands. This is due to the absence of hair follicles in this region. Keratosis pilaris is commonly found on the upper arms and thighs, but you're more likely to have KP if someone in your family has it. The basic features of KP that are very noticeable include patches of tiny, rough, discolored bumps on your skin that resemble the dotted skin of a strawberry. You may notice the appearance of the bumps but don't have any other symptoms. However, if you do experience symptoms, these may include irritation of the bumps causing them to become more discolored and noticeable, itchy or dry skin, especially on the backs of your upper arms, legs, or buttocks, worsening of the bumps where the air is drier like in the winter months, and rough, sandpaper-like skin where the bumps appear. Other skin conditions can sometimes manifest as symptoms, such as itchy, dry skin, eczema, psoriasis, and fungal infections cause similar symptoms. If you're concerned about your symptoms or if they linger, you should contact your healthcare provider. In most cases, your family doctor can diagnose keratosis pilaris, and some people may see a dermatologist to treat their condition. How to get rid of keratosis pilaris. There is no cure for keratosis pilaris. However, yes, you can manage the appearance of it and how it looks, but only through maintenance. You can achieve this through using laser treatment or intense pulse light to help with the redness, using serums or creams that contain chemical exfoliants like salicylic acid, lactic acid that help loosen the adherence scale in the follicles, topical retinoids, otherwise known as vitamin A. Short courses of potency typical steroids can be used for the itch, laser hair removal, and microdermabrasion or chemical peels. Let us know in the comments below if you have keratosis pilaris and what you are currently doing to manage it. What are some at-home maintenance recommendations? Number 1. Use a body wash containing an alpha hydroxy acid known as AHA, like lactic or glycolic acid, or beta hydroxy acid known as BHA, such as salicylic acid in the shower. Number 2. Follow up with either a keratosis pilaris serum or moisturizer containing salicylic acid or glycolic acid to exfoliate the skin. Number 3. Apply a moisturizer that contains urea or niacinamide, which are beneficial for keratosis pilaris to help reduce redness, inflammation, and strengthen your skin's acid mantle, the protective layer of your skin. This keeps your skin hydrated and softens the bumps. Apply moisturizer several times daily, especially after using the shower while your skin is still wet. And number 4, we also suggest using an exfoliating tool like a loofah or exfoliating glove combined with a salicylic body wash in the shower for light exfoliation. Looking at your diet. Aside from an association with low vitamin A or low essential fatty acids, there are a few studies showing there is a connection between diet and keratosis pilaris. You can look at discussing with your doctor, nutritionist, or naturopath, increasing essential fatty acid intake, taking zinc supplements, trying a gluten-free diet, or trying an anti-inflammatory diet. What are the best over-the-counter products to try to treat keratosis pilaris? If you're familiar with body acne or pimples on the backs of your thighs and back, you can use those products for keratosis pilaris too. Here are some options to be applied daily. Number 1. Synergy Skin Bacne Spray. With 19% AHA/BHA formula to clear body acne breakouts, this spray is perfect for ingrown hairs, keratosis pilaris, and body acne. It is a multifunctional spray to reduce the appearance of blocked pores with lactic and salicylic acid to exfoliate and decongest, while containing aloe vera to reduce redness and soothing the skin. The Synergy Skin Bacne Exfoliating Body Spray retails for $69 Australian dollars. Number 2. Synergy Skin Bejuvenate Body Lotion. With 9% niacinamide, a non-greasy body lotion that nourishes dry skin and improves hydration, barrier strength, and uneven skin tone. Bejuvenate also contains marula oil, which is rich in essential fatty acids to help reduce redness while healing and moisturizing the skin. Synergy Skin Bejuvenate Body Lotion retails for $64 Australian dollars. Number 3. Eucerin Urea Repair Plus 30%. An intensive treatment cream for dry to very dry and rough skin. The Repair Plus cream contains ceramides, 30% urea, and natural moisturizing factors to hydrate, repair the skin's barrier, and bind water to your skin. Eucerin Urea Repair Plus 30% retails for around $19 Australian dollars. Number 4. Medicate Smooth Body Exfoliating Kit. This exfoliating kit is a 3-step cosmeceutical body system. The kit comes with an exfoliating mitt you can use dry or wet, like a dry body brush, and the smooth body scrub and lotion. They both contain lactic acid as an AHA and salicylic acid as a BHA to thoroughly exfoliate the inside of blocked pores, plus deeply hydrating ingredients like squalene, glycerin, and urea. The Medicate Smooth Body Exfoliating Kit retails for $109 Australian dollars. Number 5. PCA Skin Body Therapy. An advanced body treatment with a high concentration of lactic acid that works on the surface of the skin to improve tone and texture, gently increasing cell turnover to reveal smoother, more even skin. PCA Skin Body Therapy also contains hyaluronic acid and shea butter to lock in hydration and soften the skin. PCA Skin Body Therapy retails for $110 Australian dollars. Moisturizing or exfoliating alone will not solve the problem. You must be doing both daily to manage your keratosis pilaris. To prevent scarring or infection, you shouldn't pick at, scratch, or try to pop your keratosis pilaris. It does take time for your bumps to minimize. However, if you follow your treatment plan, you should start seeing an improvement within 6 weeks. Keratosis pilaris is a skin condition that cannot be cured but can be managed with consistency. If you are interested in learning about skin ingredients to improve your skin, then check out our skin ingredients playlist here.